Hello, Prananda, Croeso. Welcome everybody to Scrutiny this afternoon. We're on Health and Care Scrutiny Committee. We've got a few different items on our agenda, but welcome to officers and to portfolio holder Councillor Shan. Have we had any apologies? Please carry on.
Yes, Chair, we've got apologies from County Councillors Carol Robinson and Alwyn Evans, from Officers Sharon Powell and Sharon Frewin, and Councillor Little Brighouse has apologies for lateness.
Okay, brilliant. Thank you. Election of vice chair. I understand there's been one nomination. Any others?
Just one nomination, my understanding, for Councillor Gareth Jones.
Councillor Gareth. I think Councillor Gareth was hoping that Carol was going to propose him, but Carol's not here. So I'm happy to make that. Josie, you've got your hand up.
I'm happy to either propose Councillor Gareth or to second if you wish to do that, Chair.
Yeah. Do you want to propose, Josie? And I'm happy to second.
Yes, I've spoken with Gareth. I am wishing to propose Gareth E. Jones, please, for Vice Chair.
And I will second that and happily do so, given Gareth's extensive financial knowledge and commitment to this committee over the last few years. Then what do we do? Carry on? Do we need to vote, or can we just do a show of hands?
Yeah, if you could show have a show of hands, please.
Are you able to see all of those okay?
Yeah, I'm just checking because some people are doing physical hands, some are doing Zoom hands. So I'm just double checking everyone.
I'm doing both.
Yeah, that's anonymous. Thank you, Chair.
Okay.
Unanimous.
Brilliant. Thank you.
Congratulations,
Gareth.
Can I just thank you all for your confidence? I'm not sure it's due, but thank you.
Okay, declarations of interest. I think we've got one, maybe a couple. Councillor Ange, did you have one to make? Councillor Ange? I don't know if Councillor Ange can't hear us, but I know Councillor Ange has got a declaration to make in relation to Clyce, in that she is part of it. Can that be noted?
Sorry,
Oh, sorry.
couldn't get my mouse thing to work. Yes, I have a interest in Schleiss, as I am a volunteer for them and have been for a while now.
Any others?
No, not for me.
No,
Thank you.
not for anyone else. Okay, brilliant. Anyone been whipped for today? No, I don't think I've ever had anyone declare anything under that. Then we've got some minutes of the last few meetings. Me and Gareth read through those as they come through. I don't have anything to add. I think we've amended them previously, before they've got to this stage. Has anyone else got any comments, or have we got we'll take them all three together unless anyone would like to say anything individually. Anyone got any comments? And if not, could I have a proposer and a seconder, please?
I'm happy to propose, Chair.
Thank you. Second? Does it need to be someone, carry on, who was at all three of those meetings?
Yes, please,
I
Chair.
think can it be me? Because I don't know whether
I don't think you were present at the February meeting, Chair.
Was I not?
Don't think so. I could be wrong, actually.
I think I was.
I think you are, because I can't remember.
I don't think I've missed one for a long time. I think last summer was the last time I missed one.
I don't remember you missing one, but unfortunately I wasn't there for all three, so I can't do it.
So February was me, Gareth, Chris, who's here today.
Oh yes, Chair. Sorry, you were present for each of them.
Yeah, I wasn't there for the April one.
Okay, can we do the first two then, and then move the April one to next meeting?
Yep.
Chris, could you second the February and the March one?
Yeah, do that.
Thank you. I think it's just for the public's information, we've had a new committee members join us and previous ones leave, so that's why there's an issue here. Okay, thank you. Okay, right. Agenda item 6 is the Llais Locality Report and Action Plans. I'd like to welcome Katie Blackburn from Llais, who's here today to present on these. It would be helpful, I think, if we could have the report on screen. I don't know how best to do that, whether it's through Katie's screen or whether it's through Carrie-Anne or Kat or someone else. But Katie, happy just to hand over to you. And if you'd just like to introduce yourself and also just explain what your role is within Llais. And then we've got obviously quite a full agenda today, and we've read the report. So if you're able to just maybe spend 10 minutes talking us through the report, and then we'll move on to questions, if that's okay. Right, you're still on mute though. Oh, there we go.
Thank you. Thank you very much, Councillor Amanda. Yes, welcome. I'm Katie Blackburn. I'm the Regional Director for Llais in Powys. I've got a short presentation. Well, it's actually quite detailed, but be rest assured I don't plan to go through every single page in that level of detail. But if there's anything that people would like to pick up afterwards or at a separate meeting, then please do let me know. It's lovely to be here today. Thank you for inviting me. There are some familiar faces that I know from around the table, so many of you may have, or some of you may have heard some of the information that I'm going to share today, but I'm now going to try and share my screen. Can you see that?
Yes.
That's always reassuring.
But we can see like the whole thing. Yeah, that's better.
Is that okay?
Yeah.
There we are. So just very quickly, I've introduced myself. There are 7 regions within Llais. Llais is a national organisation. It was created 2 years ago, so it's fairly new, and it's a successor, I suppose, of the community health councils, but it's quite different to the community health councils, and I'll share a little bit about that as we go through, but some of you may be familiar with the community health councils. Yes, there are 7 organisations across Wales. We're statutory, we are independent, and we are here to represent and listen to the views, issues, thoughts, opinions of individuals and communities relating to health and social care. I'm just going to zip through these as you would expect. As I said, we're independent, we're inclusive. We have a board, and those are the photographs of the board. We have a lead in Powys who is Rajan Maddock. So if anybody at any point comes across Rajan, he is the ambassador for Powys on the board. All know the map of Wales. Our staff are based regionally. There are about 180 staff. I have a team of 5 in Brecon, based in Brecon and Newtown. We have a couple of vacancies at the moment, but we rely, as Ange has already intimated, heavily on volunteers. I think we have moved away from the rather rigid volunteer structure that we had as a community health council. We're very keen to get volunteers from a wide range of different communities, different community groups. We're very flexible. If somebody can't volunteer over the summer holidays because of childcare, that's absolutely fine. If they only want to do a Wednesday evening looking at some Facebook posts, that's absolutely fine. So it's about being inclusive and being able to support our volunteers across Powys. In Powys, we have divided Powys into 13 localities, as most people have. And my dream is to have 5 volunteers in each of the 13 localities. So if any of you either would be interested in joining as a volunteer or know anybody who's interested in joining, particularly those from underrepresented groups, then please do get in touch. So really we have 3 core areas, as I say, spanning health and social care, and bearing in mind that the Community Health Council focus was on health, the area of social care is very new to us, and Nina and I are working very closely and continue to work very closely to understand what that looks like and what that means, particularly given the different dimensions of the local authority to the health board, the fact that you're all democratically elected, etc. So it's an evolving relationship, and we meet very regularly. Our first area of work is around engagement, very different to Llais. I say that Llais is about what we hear, not what we think. And so we reflect through a huge range of engagement activities what we hear, and we feed those back into either the health board or into the local authority. We do this through a number of ways. We have what we call Llais Local, which is a committed and dedicated sort of focused response to a particular geographical area. So, for example, we've just finished 2 weeks in Newtown. We'll visit all sorts of organisations. We'll visit dementia, we'll visit daycare centres, we'll visit choirs, we'll visit knit and natter groups, we will host a coffee morning, we will visit the school, the youth club, the GP surgery, dentists. So rather than just sort of promoting ourselves, we will actually have a planned approach. And I'm very happy, a little bit later on, I share with you the planned activity for this year. And I know some of you have already been along. Councillor Shan came to one in Crickhowell. I know some of you have already been along to a couple of things, and you're more than welcome to join us going forward. The second area for us, which again is new, is what we call representation. So if we hear something from a community or even an individual, we can make a representation to either the health board or the local authority asking for clarification. So if I give you a recent example, in Newtown, the Lead Club in Newtown hasn't been reinstated after COVID. And I've been in touch with the health board to find out why, and the health board have responded to me. So the health board and the local authority have a duty to respond to issues and questions that we may hear and raise, and that is quite a unique opportunity for others as well. We have close working relationships with PAVO, Powers Association of Voluntary Organisations. They obviously hear a lot and work a lot with communities, and how they feed that through us so that we can make representations on those communities' behalves. And then finally, we have an independent complaints advocacy service, and I know some of you have forwarded some of your constituents, your electorate to us. It is independent. The volunteers aren't involved in this, and we support individuals who may wish to make a complaint. Some might actually just want to share an experience and make sure that it doesn't happen to somebody, or try and ensure that it doesn't happen to somebody another time. But we have a complaints team. Sometimes it'll go directly to the Ombudsman, but we work closely with the local authority complaints team and the health board complaints team. I'm just going to skip through these couple of slides because they're very, very wordy. But one of the things I think is really important just to mention is that the work that we do is governed by some legislation and guidance. And I think that's important to understand. So there's a code of practice for access to premises. So we can go into premises, we can go into GP surgeries, we can go into care homes. There is, of course, an issue around individual homes with regard to social care, and so that's an area that we are not developing at the moment, but working closely with the local authority as to how we can hear the views of people who are receiving care in their own homes. There's also statutory guidance on representation. So there's a statutory duty on the local authority and the health board to respond to representations that we make to them. And if for whatever reason they don't feel able to respond, they need to be able to share with us why they're not responding. And finally, there's quite a long-standing statutory guidance on engagement and consultation. And that, again, relates to both health and social care. One of the big challenges for us and for you, obviously, is the cross-border and the commissioning arrangements in Powers. We have key relationships. We can't do all of this on our own. Powers, is a huge area, as we all know. So working very closely with other organisations rather than us trying to do everything, which is absolutely impossible and would not be right. There are people out there working with various groups who are far more appropriate to seek the views of members of their groups and feed them back to us. We work at a local, regional and national level, as I say, the 13 localities, the regional footprint, the regional partnership board, I always say if it can't work in Powys, then I'm not quite sure where it will work. And then we have, which again is new to Llais, the national dimension. Next year we've got some national priorities, and when I know a little bit more about them, I will share them with you. But they're around rights and responsibilities, and there'll obviously be an impact there on rights and responsibilities that relate to social care as well as healthcare, and around care closer to home. And we know that, again, that's a challenge that straddles both health and social care. This slide is actually wrong. This is what we are planning to do this year. It's not what we did last year. So the slide isn't wrong, the heading's wrong. Let me get that right. So we've just been to Llais, we've just been to Newtown, and we've been to Llanfyllin. So we were in Newtown for a couple of weeks. Llanfyllin is the public forums are a one-off where we invite people to come and sit down and talk and share with us their thoughts and their feelings of what only doesn't work, but what would it take to improve it. We're in Crickhowell in July, and I won't go through it all, but if any of you would like to attend any of those, then please do get in touch. At the Llais locals, we also have a coffee morning. So again, I think councillors have popped into that and seen that as an opportunity to see the work that we do. So please, you're welcome to any of those, just let us know. But if you'd like to join us for the coffee morning in any of them, they're the yellow ones, then please do let me know. So this is what we did last year, and there will be reports on all of these, so I'm not going to go through them, you'll be glad to know. But if there are any particular areas, all the reports are on our website. We have adopted a slightly different approach. Rather than writing a report and it's sort of sitting collecting dust, we now, after we've done a piece of work, we will pull together a stakeholder group which will involve Nina and her colleagues, and Hayley and her colleagues from the Health Board and the third sector, and the volunteers who've undertaken the piece of work. And we will sit down and we will consider what has been said, in quite a lot of detail. And from that, we will agree an action plan, which we will all sign up to and we will take forward. And some things, in fact, the vast majority, in fact, all of them will not have a budgetary implication. It might be as simple as a website being a little bit clearer, or a process being clearer. So we work together, and then we will go back in 6 months later to see whether that's improved for that community. I just thought very quickly, Chair, and then I'll sort of pull it to a close, I think, but I'm very happy to go into more detail if people would like. Just thought I'd give you some examples, I suppose, of the sort of things that we've done and the impact that we've made, because at the end of the day, as we all know, the so what question is one that we have to all ask ourselves in this particular climate, and quite rightly so. So in Glenurvan, as many of you know, I'm sorry if I'm telling you things that you know, is a facility providing short stay re-enablement in Bilf. And we did a visit to Glenurvan, and we found that there was quite a lot of underutilised beds. There were 6 out of 12 beds that were full. We found that there was a lot of noise around people not knowing what was happening and what was going to happen next and where they were going to go, and that sort of whole communication area. And there was also an issue around access to physiotherapy. And the final thing, going back to the communication, was what was the criteria? People didn't know what the criteria was to access those services. So we went in and we wrote a report, and we went back, and we had a most amazing experience, really. 10 out of the 12 beds were being utilised. The physio was going in 4 days a week, and the occupational therapist was going in 3 days a week. And there was a huge difference in a relationship between the staff and the individuals with regard to communication. People, knew what the next steps were and knew the criteria for Glenurvan. The second example I'm going to give you, I've tried to sort of spread them out across Powys, just to give you some example. As many of you know, there's a temporary service change currently in Llanidloes Hospital, which relates to the co-location of the Ready to Go Home unit. Just over Easter, I had 26 emails from the community asking a number of questions. And it was all, again, many of it to do with communication. So I went back to the health board and raised the issues and the concerns that the community had and had a response, and shared that back with the individuals, but also with the communities themselves. So the things that they were talking about are, what are the processes and the timescales for the changes? Are there any other changes? How are we going to be communicated with? What current services are being provided? And also, which was quite interesting, whether there were going to be whether the consideration was going to be given to any unintended consequences. So it was my responsibility to raise those things with the health board and to get an outcome. And as an outcome, we were obviously signposted to various web pages, but also some new web pages were established so that people could have regular updates. I've already mentioned the lead clubs. I think the day centres is quite an interesting one. I know you've recently done a review of your daycare services. It's something that crops up in every visit that we have. The importance of respite, the areas around isolation and socialisation. So we will be watching those developments very carefully and closely. And making sure that we engage with communities when we're out and about, just to hear how those sorts of proposed changes and the implementation of them are actually feeling for them as people. We have one of the advocacy examples, which was around a deaf carer. We've identified across Powys a significant feeling of isolation and gaps for carers in Powys. So that's another sort of thematic issue that we're picking up. But a deaf carer having communication issues, not being obviously able to telephone, only telephone numbers being given. So the outcome of that was that the Wales Ambulance Service introduced BSL and deaf awareness training for all their staff. They also introduced, I've got no idea what this means, but a video relay translation service for the non-emergency patient transport element and the putting things right. There are lots of alternative options for communication in letters, appointment letters now. And I think one thing that I'm particularly proud of is that my advocate who dealt with this was invited to present to the Senate's cross-party group on deaf issues. I think I'm not going to go into detail about all the reports because they're all there, and there is a summary, there's an executive summary, and some of you may be more interested in some areas, whether that's geographic or thematic than others. But it won't surprise any of us that, the key themes that we hear about is around access to services. It's about delayed transfers of care and social care packages. And as I've touched on, the issue around carers. With regard to partnerships, I've mentioned we can't do any of this on our own, so we develop very strong partnerships with organisations like Men's Sheds. We've got a strong relationship with Credi in Powys. We've got strong relationship with Dementia Matters. We're about to do some work with the Nepalese community in Brecon. So it's about using and supporting other organisations and using the guidance and the statutory cogs, I suppose, to actually be able to impact and make a difference on the lives of people in Powys. I shall stop there, Chair, and happy to take questions, whatever. Sorry, I think you're on mute.
Is that better?
Yes.
Sorry, I clicked a button. Thank you, Katie. No, that was really helpful to hear from you, especially on that last section in terms of the so what and the difference that and the feedback that you've been able to pick up, etc. I think we do have some questions. I'll ask you an overarching question just at the outset, just for you to be thinking about. In terms of if there's any areas that you're picking up in terms of key themes and trends that you would like to our scrutiny committee to pick up on and would like to come and observe when we do so. I know you've mentioned about day opportunities, so I think that is already absolutely on our radar, but I'll just leave that as an overarching question. I know Councillor Chris and Councillor Gareth, you had some other questions as well.
Yeah, I'll let Chris go.
Go, Chris. I can see Chris.
Thank you, Katie. I mean, I've heard a number of different presentations from you, and I'm glad you were able to unpack the latter slide, giving a bit more detail around the activities on there, because I think it's really helpful. One of the things that you had on that slide was about the cross-border issues with England and that on there. Do you get many requests for issues that have been raised from the English side coming to you about being that link or that liaison with local authorities here, particularly with Powys at all? Or is that still a developing area? And are you able to go in and look at one of the English hospitals if need be? Is that within your scope now? Because community health councils had a very different remit to yourselves, and likewise with the local authority, that's something very different on there. And then my other question was, but you partly answered it because you were saying that some of the reports that you've done are on your website, but the analysis of support of carers, and you mentioned things like linking that to some of the day centres and respite. That's quite interesting, and I just wondered whether, because I wasn't aware that that was there, so I don't know if there's something where you need to, how that's publicised when you've done those analysis, etc. Had that been taken into consideration within the day centre review here by the local authority? Because obviously I missed the discussion last month regarding the new model that's coming through. So I just wanted to tie those things up, and I'll stop there. Thank you.
Thanks, Chris. Katie, are you able to pick those up?
Yeah, I will. I mean, the cross-border issue is, I think, an issue for both health and social care, having different systems. You know this as well as anybody, having different systems, having different communication channels, systems not talking to each other, and it's the patient or the individual who gets caught in the middle of all of that. And we hear stories of people having to take photocopies with them when they access services in England, and you don't. There should be, as we all know, an individual sort of passport that has all the information there, whether that's health or social care. So there's a lot of work to be done. I sit on the cross-border network, so they meet every sort of quarter, I suppose, but that is only health. And I do ask the question about whether there is a similar or should be a similar arrangement for social care, but that's at a sort of national level, I guess, but it does impact hugely on Powys residents. The access to English services, Chris, to be honest, we've never had a problem. It's not embedded in legislation, but it doesn't always have to be embedded in legislation. I think it's about relationships, and I think if I don't know, Shrewsbury decided to say, no, you can't come in, I think there'd be a very serious question to be asked as to why that has been said. And we don't have that. I'm just using that as an extreme example. Shrewsbury, in fact, are very, very happy for us to go in, just using Shrewsbury as an example. We've not, I suppose it's an area perhaps we might want to sort of look at about services that are commissioned by the local authority from England and where that sits. But I think we've probably got quite enough on our plate at the moment to understand the role, the new role with Llais and local authorities in Powys at the moment. But I think that's a very interesting point. Yes, the carers and the day centres, I mean, it was a very, very strong voice. It came out firstly in Welshpool. It was very loud in Crickhowell at the public forum. And I think, it is about people feeling isolated, feeling lonely, and needing some respite. Just I think respite is a really quite significant issue, particularly in rural areas. So
on that point, Katie, can I ask Councillor Shan and Nina Davis, who are on the call at the moment, how they've then followed up with that intel that you were able to highlight and raise as part of their day opportunities review that has been going on?
Hello, thank you. Sorry.
Hi, Nina.
Good afternoon. Hi, Nina Davis, the Director of Social Services and Wellbeing here. Thank you for the question. There's lots of different ways we're working with LICE at the moment. I meet very regularly with Katie. We have regular one-to-ones, etc. We're involved in, Katie was talking about the LICE local events. So there's as she said, a regular feedback session, I think they're called, where we meet with colleagues and volunteers from LICE and with also colleagues from Powys Teaching Health Board as well, where the volunteers and LICE colleagues go through the themes that have come out through the conversations. So we can take that on board and we respond to that as well. As Katie said, we've got a duty to respond. So as part of that process, we will provide information for an action plan. So, and one of the other things that's also happening is you have an annual report come to you as part of our complaints, feedback, compliments kind of process. And what I've been asking to happen is that the feedback from LICE we're starting to incorporate into our normal processes, because as Katie said, you know, this is new to all of us at the moment. We're 2 years in, but we're still working together to develop how we work together, because we don't want to be duplicating processes as well. So we're looking to include the feedback as part of our normal feedback process. So from any complaints or from any compliments or from any feedback, we take learning through that team and take those back to the relevant service areas as well. So just wanted to give a bit of a brief overview on the kind of the way that we're embedding this within the service. But it is a learning process as well, and I'm sure Katie will agree with that. We're learning, we're trialing stuff. I think we're being quite good here in Powys about how we are trialing new ways of working between ourselves and LICE. So that will be, I'm sure, a process that we'll continue to work on together as we move forward as well.
And in particular, the feedback and to do with the respite and day opportunities. Does Councillor Shan want to pick that up?
Thank you, Councillor Amanda. I can't speak specifically to the feedback from the LICE events. More broadly, we get feedback about carers and their ability to take the respite that they need through working with the Commission Provider Credit, and it's feedback that I get quite often just with the carer groups that I've got relationships with. So as the day opportunities review unfolded, there was an emphasis and a focus on ensuring that the new model will enable carers, that whole system of carers getting respite in the form that they need it to be in, when they need it in a way that supports them to manage their role.
Okay. So Katie, in terms of us going forward with the day opportunities, is we can invite you to be an observer as that progresses. Would you like yourself or someone else to come and hear our scrutiny sessions of the day opportunities, given that that's a theme that's been identified with you?
Yeah, I'd really welcome that. Thank you, Chair. Yes, and it would be me. So thank you very much.
Carrie-Anne, can we please make that a recommendation from, well, I don't know whether recommendation is the right word, but it's an action point from our committee that we will like to invite Katie as that goes forward on our work programme. That would be great. And then I'll need to take advice, I think, as to whether or not I'm able to get feedback from you, maybe once the papers are published, or whether I'm able to ask you to comment during that process. But I'll need to take advice on the workings of the committee and what I'm allowed to do on that. So thank you. Was there any other questions to come back on with Chris? Sorry, I interjected.
No, I mean, I think they've covered them off. As I say, I wasn't familiar with the report being published. So as a local member within Brecon, I don't know how you share that across. But likewise, if you're going into other community areas, it would be helpful for the local members to be aware of those analyses, because we can take those on board and steer people and direct people. Plus it helps us with our questioning of different papers and changes to models going forward.
Can we make a recommendation as a committee that any reports that come through LICE that obviously get sent to the council as well are then specifically rolled out if they're location specific to, like, the links are just shared to all councillors or to the councillors of for the specific locations.
Mm.
Because what happens, Katie, when you finish a report? Does it goes on your website, but do you then, is there a correspondence between you and the council to do with that, or you and the health boards to do with that?
Well, I mean, we agree an action plan. We
Yeah.
agree all parties sign up, might be the third sector. We will agree an action plan, which we then publish. We'll go back to the community and say, you know, you said, we heard, we're doing, or whoever's doing. So we sort of close that circle.
So but in terms of the publication of the report,
yeah,
so there'd be communication. So once that communication has been given, I think I'd like a recommendation that if that communication involves the council, then the council then forward the links to that published report, either to all councillors if it's a general Powys issue, or if it's location specific to the councillors that are relevant. Is that okay with you?
I can pick that up with Nina. That's absolutely fine. That's
okay,
fine.
thank you. Right, I would like to only spend five more minutes on this or so. So, Councillor Chloe.
Thank you, Chair, and sorry, hopefully it will be quite quick. It's just to understand a bit more about Slice. So I'm quite new to a lot of this. I did come to the meeting last year we held in Crickhowell, and it was really interesting to see some of the, to hear the views of different people about the provision in the area, and it really resonates with what you're saying obviously today about access to services being one of the issues. And I just wondered, I hear what you're saying about the communication channels and being able to be that voice for people, but is there any sort of action you can take, or any powers you have to encourage action in particular areas where there is, for example, a lack of access to services? So as a specific example, when a dentist, that's what happening at the moment, a dentist is closing, but it applies equally to when different provisions close across the area. Are you able to, is there any requirement on people to sort of respond to your feedback in any other way rather than just to say, yes, we're closing it because we had to, if that makes sense?
Katie?
Yeah, I mean, in those situations, I work on the basis of both the health board and the local authority of no surprises. And obviously the situation in Crickhowell and how that was communicated left quite a lot to be desired. So we have been in touch, using that as an example, Chloe, we've been in touch regularly with the health board, and we are looking at alternatives. And the other thing that we look at, and it goes back to those rights and responsibilities and that piece of work, and it's relevant to the local authority as well, is actually what duties do organisations have to provide and commission certain services. So I'm conscious of time, I'm happy to have another conversation outside of this room, but we would be and are looking at what those alternatives might look like, both in the shorter and the longer term.
Thank you.
Yeah, I think for anything that's location specific, I think maybe we need to, again, potentially as a recommendation from this committee, is that we need to remind and make councillors aware that there can be a communication channel between them and yourselves. So, because I think obviously Slice is fairly, in its infancy, or maybe we should say it's in its toddler's years now, because it's out of baby years. And I think there's a lot of councillors who have been around for a while that still wouldn't know a lot to do with the work that you pick up on, and that they can come and ask you for your your intel and your feedback. So I think if we can make that as a recommendation, and then for example on Councillor Chloe's issue here, she would be able to have a more detailed conversation with you outside of scrutiny, that would not only inform her as a scrutiny member but also as a local member.
I think that would be really helpful, and we do that with all the AMs and the MPs. We have regular sessions with them, and we pick things up, and we do it with some councillors. So, and there are a number of councillors as well who are volunteers, so that may be another avenue for communication, but I'm conscious of time.
Yeah. Nina, did you want to pick up on that point?
Yeah, thank you, Chair. As one of the things as a local authority is that we've got a duty, I believe, to promote and signpost, isn't it, to Llais, Katie? So I was just wondering, Chair, whether a member briefing session, Llais, if they were interested in coming and delivering a member session to all members, it might be quite timely now we're 2 years in to kind of remind everybody about the role of Llais, but also how councillors can get involved and also how they can access that locality information that you were talking about that they might be interested in as
Yeah,
well. So I
and
just wanted a
also
suggestion.
because Slice is looking for volunteers in specific areas, that would help that as well. It would be also
Absolutely.
helpful, Katie, if you could let us know which areas you're specifically looking for, so that maybe we can try and use our own local knowledge. And the other thing I was going to say, Nina, is if you do that, obviously not all members are always able to go to member developments. Can it be recorded, or can the presentation be
Absolutely.
available to all? And I'll take this as the final question then, Councillor Gareth.
Yeah, mine's very quickly. I think it's just a yes, no. Can I just ask, is the support from Llais available to those families and clients who are self-funding in care homes?
We support all individuals in health and social care. The specifics of it, if there were complaints and things, there is sometimes a little bit of a, if it's not always crystal clear, but no, I would encourage anybody, if they've got any issues, concerns, or whatever, to come to us. And each case is always different, Councillor Gareth. So yeah, don't please bring any cases to us. I must just add on that we have had councillors who've brought cases, and of course, but some of our services are confident, and AMs and MPs, some of our services, particularly the advocacy services, is confidential. So we would not be able to share what's happened with a particular case. I just need to be really clear about that.
Yeah.
It is a confidential service. But yes, please, any issues, just raise them with us, and we'll see. If we can't help you, we'll make sure we're clear about that.
Thank you.
Thank you. And then back to my original question, Katie, on themes that that you're aware of. Obviously, you've touched on access to services and the respite and day centres and day opportunities. I don't want to particularly put you on the spot today, but I know that those things will be picked up in your annual report. When could we expect to receive the annual report? And is there a way that you could feed back to us outside of that if there was a key theme emerging that couldn't wait to the publication of the annual report? Oh, you're on mute. It's back up. You're still mute. There you go.
The annual report is an All Wales report. So actually, I think Nina and I probably could do with a little bit of a conversation about how we make sure that we are feeding these in. Nina and I communicate regularly, but perhaps we need to sort of almost formalise some of it so that you get those themes as we go along. I should think we all have the same themes. It is about accessing services. It is about travel. It's about appointment times and people needing to get home at having an appointment at 8 o'clock in the morning, whether that's health or social services. It's about cross-border issues. The issues are probably unfortunately still the same as they were a year ago. The challenge for us is how can we actually move forward with some of them, and I think that's really key. But yeah, I'm Nina, perhaps you and I could reflect on that, if that's okay.
Thank you. Well, thank you ever so much for coming to Scrutiny. It's been great to have you, and let's make this a way of you being involved going forward. Okay, so the next item on the agenda is the Corporate Safeguarding Board March Activity Report. And we've read through this, and I think we've got Councillor Richard Church and Nina is obviously here. Councillor Richard, are you introducing this?
Nina usually introduces it. If Nina's here to do that.
Yeah, Nina is here. Are you able to give us anything that came out of it that are your sort of key headlines of things that you want to be aware of going forward as the corporate safeguarding lead? Or do you want me to leave you with that question and you come back to it after Nina's?
I'll come back to it at the end if.
Okay, thank you.
Miranda,
All right,
that's
Nina,
fine.
I'll hand over to you then, please.
Thank you, Chair. So the report in front of you today is an update from the Corporate Safeguarding Board that was held on the 13th of March. As always, the first agenda item, we looked at review of progress against actions on the tracker. It was noted that the corporate safeguarding policy would be 3 years old in December, which has just gone by so quickly, I can't believe it. So we're going to be started now in the next couple of weeks, a review of that policy to make sure that it's done and completed before that December deadline. There's one recommendation on the regulatory tracker, which was discussed at the meeting, and it was agreed that that would be reviewed by myself at the end of Q2 with consideration for closure. We then welcomed a presentation from the Powys Ukrainian resettlement team. The work, just outlining the work that that team has been undertaken, and also that they'd won a Wales Safer Communities Award in the Equality, Inclusion and Cohesion category. So the team is a non-specialist team within the council. It supports Ukrainian sanctuary seekers to become self-sufficient. It's a team of 7 officers looking to maximise support and safety, support cohesive communities and minimise the impact for public services. Really focus on making sure that, reducing and preventing homeless presentations and providing tailored packages of support. So within the report, I've included some data, so to see how we compare across Wales, but a real, a lot of very positive activity happening here in Powys County Council, a real community-led approach. There's regular communications as well through the host forum, drop-in sessions, newsletters, and also coordinated along with PAVO Refugee Support Group. A small grant scheme as well has supported over 1,100 individuals. And just a note, of course, that Powys is moving towards county of sanctuary status and organises a lot of events and activities to support that. So a really interesting presentation and discussion that followed at the board, and the board congratulated the team on the award and noted the work undertaken across the county to welcome and support people from Ukraine. One of the things we also do at every corporate safeguarding board is we have a look at the work of the regional safeguarding board and information coming through there as well, which is really important. So we've received a report and updates on the activities of various subgroups within the safeguarding framework. We had updates on the consultation stage for the digital adaptation of the Children's Threshold document. Information on the All Wales multi-agency referral for MARF, regional policy being developed for managing cases of fabricated illness, for example. We have also updates on training activities and events that are ongoing as well. There's an update on the National Centre initiatives in terms of addressing child sexual abuse, including response pathways and guidance for supervision. And also information on the single unified safeguarding review update, which is new statutory guidance for safeguarding reviews. So again, another item that is of obviously significant interest. Discussion on the rapid response process as well, and how that is convened within 48 hours when there's a death through suspected suicide in the county. We also shared the Charter for Families Bereaved Through Public Tragedy, so that was highlighted and attached for information for the board. We then, as a board, oversee mandatory safeguarding training, and we noted mandatory safeguarding stands at 96.6% at the time of that meeting, which is excellent. A real priority and focus for the board at the moment is about volunteers and safeguarding, and steps are being taken to enrol volunteers and making sure that we're overseeing the safeguarding training for volunteers. We also noted staff compliance with VAUDA SV at 96.6% across the council as a whole, but slightly lower compliance with primary schools at 61.1%. So we make sure we look at that information in detail and picking up any queries. Aston Level 2 training has got strong attendance with more than 800 staff members now trained. Noting the regional partnership support for schools in terms of relationships and sexual education curriculum as well. One of the things that we discussed as well at the board was we noted that within schools, people have been logging into the training correctly, which is affecting the accuracy of the data. So this has been noted now and picked up, and measures are being put in place to make sure that that is amended moving forward. We received a report on safeguarding education from the council, so noting the number of electively home educated children across the county, and that data includes the number, those eligible for free school meals and those identified as having additional learning needs example. We also looked across geographically across the county as well. Again, noting Powys is part of the Welsh Government pilot programme on children missing education, and the first sharing of that data is due to take place in April. We're also in part of the Safeguarding Education Group reviewing statutory guidance on handling allegations against teachers and staff as well. Another key item that we cover in our boards is summary of learning from child practice reviews and adult practice reviews. So the board received an update on those reviews from across the region, and we make sure that any recommendations and learning relevant for here in the council are picked up and discussed as well and overseen. Future focus action plan. So I presented as chair a new action plan to the board. Following on from, obviously, we've got no new recommendations following the Audit Wales follow-up inspection, but we've noted areas of priority and improvement that we would like to focus on. Volunteering is one of those key areas as well. Contract management, oversight of training as well for volunteers, schools compliance with training and mandatory training, and contractors guidance as well. So just important that we're looking ahead and identifying and keeping identifying what our priorities are. In terms of normal safeguarding performance reports, we had a presentation from Adult Social Care. We went into quite a lot of detail in different areas in terms of safeguarding referrals, in terms of challenges and impact on the team, etc., any workload concerns. Actions to address issues of improving recording practices, which have contributed, and we're exploring the use of AI as well to support safeguarding tasks, which we'll look forward to taking back and presenting at a future meeting, because we've seen some really positive outcomes from that work as well. So noting completing 94% of inquiries within timescale and an action plan on the adult safeguarding as well. We also received an outline performance update from Children's Services as well, noting the number of contacts, a lot of details and performance, etc. Noting increasing improvement in performance in assessments to 88% in January. Also, a discussion on the number of children on the Child Protection Register and the changes in that, noting the complexity of the referrals being received. And noting also the performance in child protection visits as well within statutory timescales, getting up to 94% in January, but also noting there had been a dip in December as well due to staff sickness and engagement. We also had our safeguarding report from housing, where we looked at the number of current homeless households, but of those, 11 which were identified as care leavers or individuals at risk of exploitation. We also looked at the waiting list data, noting there the implications also on care leavers. And so really detailed agenda as always, really full meetings, really good contribution, and just noting that our next board meeting is on the 12th of June. Thank you, Chair.
Thank you ever so much, Nina. I know we have got a few questions on this, so I'm going to kick off with Councillor Chris. Chris? No, Chris, we can't hear you. There you go.
Sorry, my mouse deciding to play a different game. Right. Thank you, Nina. As usual, a very comprehensive report, and in some of the commentary, it's been helpful because you provided some additional detail, which I think has been helpful. A lot to celebrate, but also some areas that just need a little bit more exploration, if I may. Can I first of all congratulate the team with the award? It's credit to the work that they do, and pass on congratulations and that on there. You mentioned that 3 years has gone very quickly. I don't disagree, and that. how often should the safeguarding policy be reviewed? And you mentioned a couple of the adult and child practice reviews and different legislation. Are you taking that on board in relation to that policy development? And if there was then changes on the, can you just give the assurance to the committee that those recommendations would be taken earlier than a 3-year review, so that we're not behind the curve, we're actually in front of the curve in that sense, because 3 years is quite a long time in relation to a policy, and it should always, in my view, be under review. You mentioned the mandatory training, and I'd actually wrote down 96.6 is excellent as well. So I'm on the same page with you on that. But I do have some real concern when I see, particularly in primary schools, a 61.1%, particularly at level 1. Can you just clarify to me that the level 1 is the mandatory for everyone to do? And I can't understand then, if that's the case, why primary schools are behind the curve with that, because that's one of probably the a main area of concern going forward. So I'd be grateful for that. And then you mentioned 800 individuals that have now done the Ask and Act level 2 training. Out of how many? What's the percentage compliance with that? And how many need to actually have that level? And I'll stop there at that point. Thank you.
Thank you, Chris. Nina, are you able to pick up on those questions, please?
Yeah, thank you, Chair, and thank you, Councillor Walsh, as well for those questions. Just to assure you, yeah, policies are, as you say, under constant review. And if there is any learning that comes forward or any change in terms of any guidance or statutory legislation, etc., then policies are picked up and reviewed absolutely sooner than the deadline. The 3-year deadline is like the absolute maximum we go without making sure that we're reviewing. But yeah, policies very often are looked at and reviewed more regularly. So I just wanted to give you that assurance that that is the case, Councillor Walsh. In terms of mandatory training and schools, the exact same issues that you've been picked up, Councillor Walsh, are what the board have been picking up on in terms of those figures within the schools. And that's how we've found out, and it's been reported to the last board, that there has been problems with the data entry, which I noted within the report. So we are looking into that, and we're going to have more information and detail on that at the next board meeting. So you're right, it's the mandatory basic level of safeguarding, but it's not the only safeguarding that it does happen in schools as well. So just wanted to give you that assurance, and to assurance that this is something the board are looking at and will be looking at moving forward, to keep a close eye on it as well, Councillor Walsh. In terms of the 800, do you know, I knew you were going to ask that as soon as you started, and I can't give you out of how many the information here today, and I'm really sorry I don't have those figures to hand, but I can certainly get them and make sure we include them in the next report. Thank you.
Yeah, we'll
Okay.
make that as a recommendation,
Yeah,
please,
thank you.
Nina. Carrie Ann, if you can pick up that recommendation. And also, if we could make it as an action point for us that we want to keep a note on the 61% and monitor that going forward, just so that we remember as a committee to review that next time. Councillor Gareth.
Yeah, just following up that point around primary schools, would I be right in assuming then that there isn't an issue in the secondary and special schools, or is there are they achieving a higher percentage rate, or perhaps you don't know that? The other issue I've got is you mentioned use a lot of percentages in the report, and I'd like to know, you've got the one about 94.4% being completed, and like Chris has asked, around 800 out of how many, I'd like to know what the 94.4%, I'd like to know the numbers. So if it's 94.4% of 1,000, then I can work out how many haven't actually undertaken it. So a bit more clarity around those numbers.
Nina?
Yeah, thank you, Chair, and thank you, Councillor Jones. I'm afraid I don't have all of those numbers and statistics to hand, but I can certainly take an action back that where we are in the activity report picking out statistics, if we could try and use the numbers as well to provide that context. Because of course there is a lot of detailed reports that go to the board, and so there will be more detail in there, but I will take that as an option. I absolutely understand it's that context as well, not just the figures or just the percentages, so I'm happy to take that back.
And I think
Thank you.
Cabinet need that context as well for when they review this as well,
Yep.
so that they can
Thank you.
highlight, it can highlight for them
Mm.
any questions they need to ask. Councillor Little, I know you had some questions on the information to do with the suicide occurrences in Powys that was provided through the Regional Partnership Board. Did you want to ask those questions now, or would you rather that we take that as an action point as a committee? Because I think we've got a few questions in that area.
Yeah, I do have quite a few questions on my list. I've got 10 at least.
Are they questions to do with how it forms as part of corporate safeguarding, or are they more questions where you like some more information on the background?
I've got a couple of questions on overview and transparency, some on rapid response protocol and learning, the training that's involved, what mechanisms, for example, are in place to ensure that learning from rapid response reviews is turned into tangible preventative action, and how is that monitored across different services? Have any...
Okay, I think what I'd like to do then, Councillor Little, is I think I'd like you to ask your questions so we ask them publicly, but then what I think would be good to do is if we ask for a written response on those questions insofar as it's relevant to the corporate safeguarding board and to both children's and adult services. Are you happy with that approach?
I am, yeah.
Yep. Okay. Do you want to rattle through your questions then? And if there's any overarching things that any of the officers or portfolio holders can answer, then they can do so then. But otherwise, we will take it as a recommendation that we'd like those questions responded to in writing formally, please. Go off you go then, Little.
So, overview and transparency. The report notes 28 deaths by suicide in Powys so far this financial year, with 14 rapid response meetings, including one involving a child. Can we be provided with trend data over the past 5 years for a better understanding if this rise is part of a pattern or an anomaly that's been missed? And what demographic information can be shared about those who have died by these means? For example, age groups, geographical spread, known vulnerabilities. Are particular groups such as care leavers, disabled people, or those in rural isolation disproportionately affected? Do we have this information? When it comes to rapid response protocol and learning, how is the 48-hour rapid response process implemented in practice? Who is typically involved in these reviews? Are families, communities, or those with lived experience involved in shaping the immediate and long-term response? What mechanisms are in place to ensure that learning from rapid response reviews is turned into tangible preventative action, and how is this monitored? Have any recurring themes or missed opportunities been identified across the 14 recent rapid response reviews, and how are these being addressed at a strategic and an operational level? Moving on to integration and system accountability, how well are services such as CAMS, GPs, education services, and third-party voluntary organisations working together with us to identify and support people at risk of suicide? And are any gaps in coordination or referral routines being picked up through these reviews? And also, where suicide involves children or vulnerable adults, how is safeguarding triggered and followed through post-incident to both support those affected and to ensure the wider lessons are applied? Moving on to resource and capacity. 2 questions. Given the increase in rapid response meetings and suspected suicides, does the safeguarding team have the capacity and the training required to manage the emotional and logistical demands of the critical work that's required here? and what support is in place for frontline staff, particularly those involved in safeguarding, education and crisis response, who are dealing with the emotional impact of cases such as that involved suicide. And finally, public communication and accountability. Given the seriousness of the situation, how this council is ensuring that public is informed without fearmongering, and that people know how and where to seek help if they or someone they know is in a similar crisis. I know from my own experience in mental health and working with mental health services voluntarily over the years, that there is a lack of awareness publicly in how to access these supports and what support is available in the county when it comes to suicide crisis. And finally, will the committee receive a written report or thematic analysis of suicide-related safeguarding work at the end of the financial year? And if possible, can this include a summary of recommendations and preventative actions that have been taken?
We do have all of these questions in writing as well, so I think we will forward those on to officers, because obviously there's quite a lot of detail there. As a committee as well, we're quite interested in where there has been a young person who has tragically committed suicide, how any learning and themes or trends is fed back through the other corporate, not just the services, but the corporate governance of Powys County Council, including Cabinet and the Education Scrutiny Committee, or any other, housing, for example. So if we can add that to our questions as well. And I'd like to publicly thank Councillor Little for the interest and the work she's done in compiling these questions, and just invite officers, do you have any comments you'd just like to make at this moment, just wary of time, and are you happy to receive these questions in writing?
Yeah, thank you, Chair, and absolutely happy and would welcome to receive those questions in writing. I tried to get the gist down, but I'm sure I wouldn't have got it all just then. So thank you, Councillor Little, for the time and the detailed thought that's gone into those questions. Really powerful and important questions and issues that you're raising there. There is not the time here this afternoon, absolutely, to even give that a fraction of the time that it deserves. But if this is an area, and it sounds like it is, that you as a committee are really interested in, I think it would be perhaps a really good item for a deep dive, or for a future scrutiny, for example. At the Corporate Safeguarding Board meeting in March that we're talking about here today, the information was provided as part of a regional safeguarding update. And it was noted within that update that and the discussion that we had at the board was about the trends and the data. So a lot of the similar kind of themes that you were just asking then, Councillor Little, were picked up by the board as well. It was noted that the Powys Teaching and Health Board are going to be doing a review into that data and trends at the end of the financial year. So because of course this is multi-organisation, multi-agency kind of area of work. It's an area of focus, not just, of course, important for us in the local authority, but in health and other partners as well. So perhaps, when we receive that report, it might be timely then to look at it and bring it forward to scrutiny at that time. I don't have a date, I'm afraid, for when that review will be undertaken and completed by, but I can certainly take an action to find out from Powys Teaching and Health colleagues more information about that. And I think, Councillor Little, you also, you really raised important points there about the demands and the emotional impact that it has on staff. Absolutely, it absolutely does. And so, it's really important that we're supporting staff through these really difficult areas as well. And of course, awareness of where people need to go as well. So lots of really important issues raised there. Really welcome those and the focus perhaps and the interest in this. Thank you, Chair.
And I think just on those, a couple of points you picked up on, I think until we know the demographic and the themes behind those figures, we can't decide yet whether or not we want to do a deep dive, or whether or not. But once we can see those, then we can make that decision. Also, as this has cropped up during the regional safeguarding feedback. Is this the regional safeguarding partnership produce an annual report? Is that something that we can be provided with as well as this report relevant to here as well? Can it be noted that Scrutiny like that on an annual or basis and also when any other reports are provided so that we can see whether there's any other areas for deep dive?
Yeah, thank you, Chair. I think that would be a really good idea if we include annually that we bring that annual report here for scrutiny as well. So happy to take that as an action. Thank you.
Thank you. And I've just got one final question on the corporate safeguarding report. In that, thank you for following up on our recommendation to do with the volunteer safeguarding training. And we've seen a paper on that, and that, you know, I think that's come directly from this committee's recommendations. So I think that's a really positive so what difference that we've made through here and with yourselves. Can we within that report though have a definition of how you define volunteers and what the volunteers actually, the different types of organisations that captures?
Yeah, absolutely. Happy to take that away as well. Thank you, Chair.
Thank you. Right, thank you everybody for your questions on that. Councillor Church, is there anything, as I asked at the outset, is there anything you just want to comment on in terms of key themes or areas that you're concerned about or interested in?
Couple of things, but I've just noticed, Chair, that Councillor Anne just got her hand up. I wondered whether
Oh,
you
I
could
can't
take
see
her
that.
first.
Sorry, Ange, I missed you there.
That's absolutely fine. I'm more than happy to wait. You've waited for me long enough some of these times. It was sort of to do, obviously, with children's safeguarding. How much, I'd sort of like to know how much we, as in social care, work with learning and skills on this, as we've got one child that has committed suicide, which is a complete tragedy. And I'd like to know from them where the school comes in with this, because unfortunately I know that school was part of the issue, and I'd like to know that we are working well with them on this, because it's a very scary place for some children, and especially some with learning difficulties and other specific emotional needs. So it's just a question on that. And I know, Amanda, I asked, and you're going to write to Learning and Skills for me to discuss that with them, which I'm very grateful for as chair of the committee, that you're prepared to do that. So thank you for that.
Thank you. I think we'll add it to the list of overarching questions into to do with suicide in terms of how where a young person is involved, how that is then how any learning or processes that are impacted are fed back through the corporate structure and governance of the council. And then I think we would like, as a committee, if this could be made as as an action point for us, please, Carrie Ann, to understand from the Learning and Skills Committee whether they are interested in or already review any relevant information to do with this. And I think, you know, perhaps it needs to be extended further than suicide, but also to self-harm as well, and how there's any crossover there with the processes. And so we don't want to be specific on any operational. It's to do with the governance of the date, you know, any themes and data. So I need to get my head around how we word that. But yes, Councillor Ange, I think we can pick that up with them. Councillor Church.
Yeah, thank you, Chair. First of all, on the questions relating to suicide, I'm just wondering whether you could ensure that Councillor Little's questions are forwarded to me as well, because I'd like to see them and have a look at them and consider how best we might look at that, whether that be through the Safeguarding Board or you as a Scrutiny Committee, or however we deal with it. Particularly in relation to young people, I would be, you know, interested in considering the links to bullying, not just in school but out of school as well. And of course, you know, the links to bullying, particularly in social media, and how what we can do as a council not just to deal with that, but also to link it, as Nina has said, with our partners in the many other bodies involved. Wearing another hat through my portfolio, I am involved in the Community Safety Partnership in Paris, which links up with the police and the criminal justice system more generally. And I would be that there may be some things, some questions that I could ask through that to help highlight this issue and consider the responses to the questions from Councillor Little. On the other points, thank you, Councillor Chris, for acknowledging the good work of our Ukrainian resettlement team. They really do a fantastic job. But the one thing I wanted to emphasise that it's not just our team within the council, it is the very considerable number of people in Paris who have welcomed Ukrainian refugees into their homes, and that's demonstrated in the figures that you will see included in the report. A very much higher proportion of people in Paris welcome Ukrainian refugees than in other parts of Wales, and I think that's a credit to the voluntary sector in particular, the voluntary groups in Paris who do all of that work, and that's fantastic. And the other thing was on the Charter for Families Bereaved Through Public Tragedy. That is a consequence of a report that was taken through Cabinet and was signed by the chair of the council a couple of months ago. And I wanted to emphasise it originates in the Hillsborough disaster and the appalling cover-ups that followed on from the Hillsborough disaster, 30 years ago now, which had taken so many years to resolve, and so many people have been blamed for that unnecessarily. But I wanted just to consider that it shouldn't just be these major incidents where large numbers of people are killed, but every time somebody gets killed in an incident, for instance, a traffic collision, we need to consider this charter in how we treat the bereaved families following an incident like that. So it's something that I wanted all of the council to take on board and to consider, not just in relation to the very big incidents, but some of the smaller incidents where one or two people may lose their lives too. And I think that'll do for now from me.
Thanks, Richard. Okay, thanks everyone for your questions on that. I have started to draft Councillor Ange a note of what I would like to propose we ask of the Learning and Skills Committee. So we will run that by the whole committee before that goes out. And now if we can move on, please, to the Cabinet response to scrutiny recommendations on budget. I would like this to be a really quick item because there's only a small number of recommendations, and all of which have been accepted apart from one. So I don't think we need to go through all of those. I know we have a bit of an overarching question on budget generally, but Nina, who's leading on this, and how would you like to do it? Given that we don't need to verbatimly talk this through.
Thank you, Chair. I think I'm happy to cover very briefly, but
Yeah.
there's been a response provided to all of the recommendations of the Scrutiny Committee. You'll note recommendation 1 we accept, and Finance have agreed to undertake this process for next year's budget setting.
Yeah.
In terms of benchmarking,
Councillor Ange, that was your recommendation. So
absolutely,
on the Bragg one. So thank you for bringing that forward, and thank you for accepting it.
Yeah, so in terms of the benchmarking data, we've agreed that we will have a future scrutiny item on this. We're just waiting to see when we're going to have the data from the local authorities across Wales to determine when we can time that one in. But we're happy and really would welcome the opportunity to look at that benchmarking data with you.
Yeah.
Partially accept of the impact assessment recommendation. There was a detailed impact assessment provided as part of that with risk and mitigation addressed. Number 4 was about further consideration made to demographic pressures. And our response to that is that they'd already been fully taken into account and best estimates provided through the FRM already as part of that process.
On that one, Nina, I think the rationale behind our recommendation was that we wanted to be assured that learning and reflection is applied to where historically you've made projections and they
Yep.
haven't come to fruition. So how can we be assured that that is undergone, given that this recommendation has been rejected?
That work is undertaken by colleagues in financial services in terms of the dynamic pressures and the estimates, and there is a tool that is used to do that as well. But looking in terms of previous years learning, absolutely that's a key point. But it's been quite accurate. There's been there is the demographic pressures coming through. They have been realised, but there's been work undertaken to hold them, for example. So I think there's we actually focus a lot on demographic pressures and making it as best as we can, and we didn't feel that there was any available data or additional things that we could be doing to improve that at this current time.
Councillors, any other questions on that particular point? Chris?
Yeah, I suppose what it comes across is it was rejected, that particular point, in the sense of we were trying to do it to be able to ensure that the budget projections accounted for the demands of the service. So when you're planning the services then going forward, it's being analysed and factored in to that decision making that then comes along with your budgets moving forward. And in some ways, it seems to me to link to sustainable Powys and also to making more resilient communities by you having an awareness of your demands, of what the needs from the communities going forward. So I didn't see it in the way that it's been interpreted, and that was slightly disappointed to see it as we reject that when we're trying to be helpful in scrutinising it.
Apologies, Councillor Walsh. I see what you mean. It's rejected because it's already been done, so it's not been rejected because we disagree.
And I think that needs to be articulated.
Okay,
I agree, and I think it's
the way
to do with the rationale.
It needs commentary to be able to say that. It's already been factored into the debate around the FRM, therefore it doesn't need to be on there.
I also think that in terms of next year's budget, where we've said, further evidence requested regarding additional costs of residential placements, if what you're saying is that's rejected because yet you have all the evidence available and you already put that into your projections through the tool, then we need the rationale. We almost need to have a little bit of a explanation as to how you do this calculation of demographic pressures, so that we know that evidence is fully factored in.
I think it's maybe I see what you're saying, Councillor Walsh. It's absolutely demographic pressures, all of that kind of forecasting work is absolutely front and center when we're planning our budgets moving forward. And we're currently doing an exercise looking 5 years forward as well. And all of that work has been absolutely key to that. So apologies, on reflection, maybe reject is the wrong word. It's absolutely, we agree with you that it's really, really important, but we didn't think there was more that could be done at this current time. Does that make sense? Yeah. Okay, thank you. I appreciate that.
But it also goes back to the point that Amanda started off on, of knowing that the figures that have been produced have been correct. Right. So we also have assurance that the process and the analysis that's been done is robust, to give us assurance that as you're moving forward with the new models, produce the outcomes that we want to see.
Yeah, and of course they're reflected in the quarterly budget monitoring that we're doing as well. But maybe could I suggest that when we're looking at budgets for next year, we have an item where we ask the relevant officers to come along and to just give you that kind of overview on how the work is undertaken and what is put in there, etc. Would that be helpful, perhaps as part of the next looking at the next budget?
Yeah, and I think when we do when you provide us with the slideshow which shows you how the different pressures for next year, it's how the commentary that sits alongside the demographic pressures.
Okay, yeah, no, that's helpful.
Councillor
Thank you.
Shan.
I'm just wondering if a briefing paper would be useful included in the budget papers broadly, the budget papers that are published.
Yeah, potentially,
this
but
in
I think
writing.
there's it's just a context commentary, isn't it, that's needed. So okay, thank you. Sorry, Nina. Then the last recommendation.
Yeah, absolutely. Impact assessment will be based on the available data. So this was in terms of the returning children closer to home 16+ business case, and the service will review, wording and amend as necessary. So we agreed to take that forward as well. Thank you.
Okay, thank you. Councillor Gareth, you just had a couple of overarching questions on budget processes generally.
Yeah, I'm just disappointed that we're at the start of period 3 in 25-26, and we haven't had any information as a scrutiny committee on last year's outturn. It's my understanding the accounts are finalised by end of April, early May in general. Now, I would expect that we would add some sort of outturn, even if it's high level position where the adults and children's were in budget, over budget, under budget, etc. Nina has mentioned about the planning for 26-27 budget. In my mind, we should be already in that process. I know, and I'm disappointed that looking at the timetable we've got for our work program, the first time we're going to have any information on financial performance for 25-26 is not until December when we get Q2, which is, in my mind, way too late.
I know we've got Q4 outturn in July, I think, but I think the question is, Nina, is whether, whether or not we know that there's a corporate process in terms of reporting back, but you are all and Cabinet are all aware of the headline figures. Is there not a way of reporting back more promptly with the headlines rather than the detail?
Yeah, thank you, Chair. I'll have to take that back to finance colleagues and come back to you on that, and whether that would be possible to bring the highlights quicker, rather, because you're aware of the timescales for, as you said, the governance process, and this meeting falls before that. So, but I can certainly take back a request from this committee to consideration of whether more highlight information could be brought along quicker. So I'm happy to do that.
I think just to talk through an example is, say, for example, you knew that by the end of Q4 you were going to be significantly over budget in a particular area because of a specific pressure. Although there is a corporate governance process whereby that would go to the finance panel and the cabinet by July, Q4 ended at the end of March, so you would be already acting on that much earlier than July if you needed to. So isn't there a way of capturing, or at least feeding back to us more quickly if that's the case?
Yeah, okay, I'm happy to take that back. Thank you. Gareth?
And to put it in the context, we're all, as councillors, we're all members of governing bodies, and a governing body was to be seriously criticised. It's the first time they looked at the 25-26 performance was in December. And I'll leave it at that.
I'm happy to, if there is reports going to finance panel earlier in the year, Councillor Jones, I'm happy that they come to scrutiny. These are your agendas, and I will bring and bring officers to answer and to talk to reports when you wish. If it falls again, perhaps, Chair, that we're out of sync with governance, perhaps there could be the opportunity for a conversation in a confidential session. Perhaps that might be something that we could look at. Yep, I'm happy to bring you info as I can.
you and myself have regular updates. Maybe if there's a headline that is, we're over, under, whatever, we can make that as a recommendation that I'm made aware, so that then at least I as chair can be saying, right, well, as a committee, we're going to need more information quicker here.
Yeah, and I can confirm that if that position arises, I would be speaking to you and letting you know. So yeah.
Okay, thank you. Right, that's that one. I've just lost my. How have I just lost my agenda? Yeah, sorry. Okay, so that's that one. And then the next, we're moving the work programming issue to the end. Anyway, the next item on the agenda says it's exempt. However, we've had a conversation before this to say that whilst we're not going to show any of the reports on the screen or go into any specific locality issues, the officers are happy for us to ask any questions in a public setting, and if we do touch on anything that shouldn't, we can stop that conversation fairly promptly, but I don't think there is going to be. So we've got the monthly performance reports of adults and children's services. We are trying to split this up amongst ourselves so that we all sort of look at different areas that we're interested in, or rather than us all just review the whole lot. So I think rather than you talk through anything on these, I would just like to know from yourself, Nina, and then any other officers that are on the meeting today, and then Councillor Sandra and Councillor Sian, are there, we've asked you previously what are the key things you go to look at, so we know that, but is there anything at the moment on these that is causing you concern?
Chair, would it be okay if I come in first?
Yeah, that's fine.
Yeah, thank you. I'd just like to take this opportunity to welcome two officers to the meeting, if I may.
Yeah, sure.
For adult services this afternoon, we've got Rachel Evans attending, and Rachel is the Senior Strategic Commissioning Officer within adult social care. So Rachel's here to answer questions or queries in terms of adult performance. And I'd also like to welcome Karen Sharp. And Karen Sharp is a Senior Manager for Early Help and Assessment within Children's Services. So she's here to answer queries and questions as best we can for you this afternoon as well. I'm happy to perhaps you could go to portfolio holders first as appropriate. It's up to you, Chair, on any feedback and comments, but happy to do so. But I would just to let the committee know that performance is something that we do look at regularly. We have a monthly meeting with portfolio holders where we go through this information, ask questions, challenge, look at the trends, etc., but also discuss what we do, any mitigation for any concerns as they come, and any action plans that need to be put in place where required as well. So I just wanted to give you assurance as a committee that this is something that we look at with portfolio holders monthly. It's looked at within senior leadership teams and management teams across social services as well. So just to give you that background. Thank you, Chair.
Thank you. Okay, councillors, have you got any specific questions you'd like to ask whilst you're having a quick think? Sian, Sandra, any areas you're particularly concerned about which have changed over the last quarter? I don't know who wants to go first.
I can come in, Councillor Amanda, if that's okay with you.
Yeah.
So it's actually not. I haven't made notes of things that have changed radically over the last quarter. But what I tend to look out for is the themes that are ongoing, month on month on month on month on month. We know the key ones and the ones that stand out for me, and we have conversations, in the meetings that Nina has referenced around the mitigation and the work that's ongoing to address them. So you'll have noted there are standout themes like workforce capacity in a number of different areas of the monthly report. We see where sickness or vacancies is impacting on teams on the ground, and I've said in the scrutiny before, that something I keep an eye on is impact in terms of stress on the workforce remaining, and whether stress factors into people being off sick as well. That's related to the reviews and the supervision levels as well. It's a theme that runs through. The flow, the hospital flow issues are ones that we return to month on month, and are featuring all the time in the discussions that we have, not performance meetings, but also in the meetings that the heads of service and director and I have together. You know, the capacity in providers of domiciliary care and the impact of that on care homes who are providing interim placements, and then that's reducing the availability of their beds. So these are key pieces of work that are going on in the background all the time in different work streams, and those are the ones that I do tend to hone in on. And
Okay, thank you, Sian. Sandra? Oh, can't hear you, Sandra.
Sorry, I was having a problem getting my hand from one screen to the other. Yes, similarly to Sian, I sort of home in, we have regular updates and any concerns that are raised, and we can discuss fully. My observations really are that our CLAR children looked after have been steady or fairly constant, which is really good. And the fact that when children are stepped down for whatever reason, very few actually come back into the service afterwards, which proves that the work that is being done is effective and very, you know, very informative, very useful.
Oh, has anyone else just lost Sandra? Okay, I think Sandra's frozen, has got connection issues. Councillor Chris, did you want to ask a question?
Yes, if I could, just bear with me. Sorry, my screen's moved on, the papers on there. There's a couple of tables in here. I mean, I'm
Which one
looking
are
at
we
the
on? Are you on adults? Yeah.
I'm on the adults one at the moment. I have got a question about children's as well, but I'm on the and I think it was tables 17, 18 I'm going to be referring to. On the tables that I see, the numbers are slightly out of sync. I don't know if it's my screen, but they seem to shift across because when I initially looked at it, the one column, which is sexual abuse, it's by the total, so it just looks out of kilter there, and that. But nevertheless, I've recently seen a report saying that there'd been a growth in financial abuse coming through, and yet we're reporting the lower elements of it on there, and I just wanted to get a feel of it on there. Is that what you're picking up? And in comparison to previous years, has 24-25 been any different on there? And then the other aspect of this one was in relation to places of where safeguarding occurred. Care home settings was quite strong at 253. Now, in the safeguarding report that we dealt with earlier, there was one particular section of that which was looking at safeguarding activity, and it made reference that there were some issues regarding workload, particularly for a particular team, and I just wondered whether that was having any impact on this particular area of the care homes.
Rachel or Nina, are you able to pick that up, and then we'll go back to Councillor Sandra because she was cut off.
Yeah.
I'm happy to come in there if that's okay.
Yeah.
Yes, in relation to specific themes, we haven't seen anything emerging that's different to any previous years around financial abuse. In relation to care homes, yes, you will see that quite a lot of the safeguarding issues occur within safeguarding settings and that within care home settings, and there's a range of reasons for that. One of the things that we regularly do is we undertake joint visits with our contract monitoring team and the safeguarding team to jointly look at some of those issues and to undertake joint investigations. Also, some of the key things that we have picked up recently is that some of the recording in care homes isn't up to standard as we would usually expect. So we have responded to that, and we've got a provider forum that we've arranged specifically just to address that theme, and we have the safeguarding team that will be able to attend to provide some very specific targeted advice and training around that. Generally speaking, though, we have really good systems in place. We have what's called an escalating concerns, and if we are seeing any particular issues with a care home, that will usually result in a targeted action plan, and we will work methodically with that care home to address any improvement issues, which we routinely undertake. And at the moment, we've got really good, robust systems in place to respond to that.
Okay.
Thank you, Rachel.
Thank you.
Chris, does that answer your question?
Yeah, that's fine.
Thank you. Councillor Sandra, did you just want to finish off saying you cut off? Did you just want to finish off saying whether you had any concerns identified from those monthly reports?
Welcome vote. I'm sorry I got cut off. I didn't touch anything. It just shot off. Sorry. I was just wanted to mention the front door and to say about the statistics of that. Although it's in the 700s, there are much more complicated issues that are coming forward with the youngsters these days. Thankfully, there's a lot of a big percentage of that is answered fairly quickly with information and guidance. So that's really, really, really positive. But there are the cases that are coming through far more time consuming for our staff and far more involved. I just wanted to say that and put that out there. And I think it's the delayed reaction or the ongoing reaction of COVID, which has caused huge problems within our communities. And I think schools are having the same sort of knock-on effect as well. I just want to put that out there. Other than that, I think our staff are doing a really good job, as you've seen with those statistics. And I'm sure that if you've got questions, I and Nina will try our best, and Karen will try our best to answer. Diolch yn fawr.
Thanks, Sandra. Councillor Gareth.
Yeah. Sorry, I got a dog barking. Yeah, just a couple of general points to start with. Is there any reason why the two reports cover different periods? Adults covers March 24 to March 25, and children's cover April 24 to April 25. Is there any reason? So the other point I wanted to make, I really like the children's services when they've got the top 5 indicators to start with. And I just wonder, is there any plans to do a similar for adults?
Nina, who's able to answer?
Yeah, I'm happy to come in there. Thank you, Chair. And thank you, Councillor Jones. I think it's just in terms of timing of when the papers had to go out for this committee. I think the adults arrived maybe a day or two afterwards. So it's just in terms of timing of the data and where the papers had to go out. But no, both children's and adults have got the April reports available now. So it's just a timing issue on that. In terms of the top 5 for children's services, Councillor Gareth, I agree. I think having those top 5 indicators is really helpful. And it's something that we're talking about in adults at the moment is reviewing the monthly performance, the information we're looking at, and we're having a look at introducing new KPIs and measures, etc., moving forward. And I'm one of the things I had noted as well, Councillor Jones, was whether we have a top 5 for adults as well. So I'm glad that you agree and support that.
Can I just add to that as well? I really like the top 5s in children's, but it'd be even better that instead of just being percentages, we have percentages and actual numbers as well.
Yeah.
You know, because, you know, showing 37% of what is another question. But
Yeah, I know that's something that you feel very strongly about, isn't it, Councillor Jones? And
I like numbers.
and I do see the point, and I do see there is value in both sets of data.
Yes,
Yeah.
obviously, I'm fully aware there may be some times when you can't actually put numbers because of the sensitivity of the data.
Absolutely, and that is the case. Sometimes when you're talking very low numbers, but I can certainly take that back as a challenge to the teams to consider. Thank you.
Yeah, thank you.
I just have a couple of questions as well. Firstly, on the adult side of things, we've asked before in Scrutiny about adults with learning disabilities who are in employment, and I think I guess it extends to crossover with children as well. You know, I think we'd like to know how best we can receive data to do with people who are either in care leavers or adults with learning disabilities or physical disabilities, and the numbers of those who are in employment, and then the breakdown of whether any of those are employed within Powys County Council, and that as a percentage as the total numbers, so that we can see whether or not there's any trends to do with increasing the numbers of people who are employed, so that we can maybe say, okay, well, perhaps we need to look for training opportunities in this type of area, or or to reflect on whether we can do more as a council to offer apprenticeships to care leavers or adults with learning disabilities or physical disabilities. So can we capture that within monthly reports, or if it's not suitable for the monthly reports, is there a better way of capturing that? That's my one question. And then my other question, which is specific to children's, is if you look at the figures as to the number of children on the child protection register and compare them with this time last year, there's a steady increase in children on that register, and also an increase in the length of time that children are remaining on that register. What are you doing to look behind that trend? Are you aware of why that is happening? Is it that we're capturing more children? And are there any themes within those trends?
Chair, I'm happy to come in first, and then Karen, if I could ask you to come in on the children's query, that'd be great. In terms of working age adults, learning disabilities, physical disabilities, in terms of education and volunteering opportunities, this is one of the ones where we are looking at putting in a new measure in this year. So absolutely, that's the work in progress. I think we've got one drafted at the moment. So hopefully that information will come through to you. I'll have to take it back about the care leavers, unless Karen has some additional information. I'm not aware of that, if we are considering to include that, but Karen may be able to answer it.
Can we make that as a recommendation from our committee?
Absolutely.
And then at least we can have that tracked, because I'm pretty sure the one you're already doing was instigated as that we'd like that data as a recommendation. That you might have already been doing it anyway, but I think it has been brought up before. And then the child protection register question.
Yes, thank you, Councillor Jenner. So the child protection register, as you've highlighted it, it's increasing month on month. So we're actively looking at that at the moment, and we're actively looking at the reasons behind that. And it's an ongoing piece of work. We're looking at whether there are differences demographically between different parts of the county and the reasons for that between different teams. I think it does link back to what Councillor Davis was saying about the complexity of some of the issues we're dealing with families, which also then links into the length of time that we're working with families. So I think there's not one single answer. Some of the other broader areas that we're looking at, and I know that Nina touched on this earlier, is looking at the renewed threshold criteria and the MARF. So looking at ensuring that we've got consistency across services and across teams and across individual social workers. I think the continued work we're doing in terms of supervision is really important, and to note that appraisals is at 100%, because I think the staff are really well managed and they have regular management oversight. Then that's another way that we can ensure that we're working in a purposeful way with families and we're working at the right level. So I think there's a whole load of things that we're doing to try to make sure that we've got a consistent approach in terms of things like using our signs of safety, making sure we're working at the right level. But we are aware that the numbers are creeping up. I think some of it is about just specific information about some of the sizes of families we've been dealing with lately as well, which has also impacted on it, but I wouldn't be able to go too much into that.
I think it'd be helpful to know the timeframes on that piece of work on
Yeah.
the child protection register. So if you've got a timeframe on completing that, or that when you're going to have generated your analysis on that,
Yeah,
could that be shared with us so that we can then take a judgment on whether or not there's anything that we'd like to do a deeper dive on?
absolutely.
And the actions as well that any actions that you identify that from that piece of work. Are we able to make that as a recommendation, please, Carrie Ann, from this committee? Because it might be that you've identified a couple of key trends to do with sizes of family, or I don't know, hypothetically, you might say, right, in this particular geographical location, we need to up our preventative type of services in this area. And then if that's identified as an action point, then there's not really much for us to then pick up on, but it would be helpful for us to close the circle to see whether there is something there. And I think that really is the key trend within the monthly reports that is of concern, unless there's any others, Karen, whilst you hear that you would like to highlight to us that you're also looking into.
I don't think there's anything, thank you, Councillor Jenner, that's any different to previous months. I think that the high cost placements is always a challenge for us. It's
Or
always
something we're
working
already
on, but it's not
always aware of, yeah.
Yeah, but it's not specifically for the last month. So I think that you've hit the nail on the head, really. It is the child protection plans that are increasing that we need to look at.
Thank you ever so much. And thank you for coming to Scrutiny. It's great to have you here.
Thank you.
Councillor Shan.
Yeah, just very quickly, Councillor Amanda, to give you assurance, the requests that you've made in relation to supported employment and indeed care leavers were part of the recommendations, if I'm correct, for following the day opportunities report discussion, and the responses to those scrutiny recommendations are going through process at the moment and will be with you soon.
Brilliant, thank you. And I think that is it. I'm just conscious of time in that I've actually got to head off within the next couple of minutes. Carrie Ann and Kath, have you got a overview of all of the recommendations that we have made?
Yes. Yes,
Can
Chair.
I just add one recommendation in terms of where we've talked about any benchmarking data earlier on? Could we just ask? This was supposed to be on the. Well, it's not ready to come to scrutiny yet, but I just wondered whether we could ask for the timeframes as to whether or not to when you're expecting to get that data, please, Nina, so that we can just factor it into our work program, and that we can just monitor that that's not slipping, because it's obviously a key recommendation that we made from the budget, and what you've commented in that item that you are able to address that recommendation. It's just so that we don't I don't want that to slip to next year's budget, basically. Councillor Ange.
It's something I missed to say earlier, and I just thought I'd try and get it in now, is over the governor's training, I missed to say that a lot of us have done training and it actually hasn't been put onto our records. So I'm wondering if when we do learning and skills, we write the letter about the one thing, whether it could be on two items, which is how are they recording the training that their governors have done and their councillors and their work people, basically. Because I know this training myself and my husband have done, and it's not
Do you
showing
think we
up.
should feed that to governor support first? So
Yeah.
with if is it oh, I don't want to
Beth,
name the officer. Yes, that's it. Don't say
Beth
the surname.
Groves.
Oh,
Yeah.
okay. I didn't want to identify anyone. I think we should just ask that question as to whether or not they've got the processes in place to make sure that they're picking up any missed
Yeah.
training, and then depending on that response, we could go from there.
Yeah. Thank you for that.
Um,
Thank you.
Right, I think that's it. Can we park, please, the committee reflection and the work programme? I think, Carrie Ann, we need to pick up on the work programme for July separately in case there's anything that's slipping. And there's obviously going to be other items that need to come on there that didn't come on today's today's agenda. Sorry, my head's all over the place now. Including the complaints report. So if we can have that as an action for you, myself and Gareth. And on that note, has anyone got any final reflections, or not reflections, sorry, any comments on today's meeting? If just was you have a quick thought just to say thank you everybody for attending today. Thank you for the wide spectrum of questions and officers, and to Katie again from Llais for coming. And I hope you found the rest of the meeting interesting, Katie. And any final thoughts from Nina or portfolio holders?
No, thank you. I think it's been a really great committee, and thank you all for your comments and your questions, and really, really value all of it. Thank you.
Yeah, I made some notes as well, Amanda, so I'll share them with yourself and Carrie Ann as well.
That would be great. Thanks, Gareth.
Yeah, cheers.
Brilliant. Right, sorry to call it to a quick close, but thank you everyone, and thanks to any of the public that are watching this.
Yeah, thank you.
Thank you.
Bye.
Thank you.
Thank you, everyone. Bye-bye.
Bye.
Bye, everyone. Thank you.